Welcome to the Doctors Making a Difference podcast, where we help physicians to be empowered with the tools they need to be successful in medicine, in finance, and in life. Join us as we highlight doctors and other professionals around the world who are making a difference. I'd like to welcome Dr. Marleen Temmerman. Dr. Temmerman is here with us today. I think you're going to find this very interesting. She has worked in Kenya for years. She grew up and went to medical school in Belgium and has had a fascinating career across a variety of places. And I've been following her work for several months. It's been trying to make the time zones connect so that we could do this recording. And I'm delighted to be able to do this recording today. So Dr. Temmerman, would you mind introducing yourself to our audience?
Sure, Peter. Thank you. And thanks for inviting me today. So my name is Marleen Temmerman. I'm a Belgian national obstetrician gynecologist, also trained in public health and global health. And I live and work in Kenya, in Nairobi and in other places where I am a professor of gynecology at the Aga Khan University in Nairobi. Yeah, that's me.
Well, it's awesome. I want to go back to when you started this. You mentioned before we hit record that you always wanted to work. You mentioned either in Africa or South America, developing countries, to make this change. And do you mind telling us about that? How did you end up doing that? You know, because you started off as a young person. A lot of people have aspirations and dreams of going and making this large impact, but you've done it. You've done it throughout your career, which is quite interesting. So walk us through that journey a little bit.
Thank you. So as a young girl already, I wanted to make sure that people around the world had the same chances. And so I was always very engaged, and I wanted to do medicine to be able to work globally in Africa or in Latin America and to make a difference. Maybe very naive when, you're a young teenager, but it was a dream that really kept me going. So I did medicine, which was already unusual because girls from my social class and my generation, they did not go to medical college, but I managed to convince my parents. We worked hard. And so I did medicine and graduated in 1978 from Ghent University and wanted to do gynecology. But when I knocked at professor's door to ask for a residency place, then he said, but what are you asking? Gynecology, but you are a woman. And he looked at me like, yes. So then,
which is crazy from today's standards. It seems like most OBGYNs are women. And so, but at that time, they gave you this crazy feedback, but you're a woman. How could you want to do this?
Yeah.
Interesting.
Yeah, because who will take care of your husband, your children, your family? Why don't you do dermatology or something else that you can organize your life? So the doors were closed. I became a GP, but the dream was there, and that was before internet, so I had to write letters to universities in my own country, in the Netherlands, in Germany, France, Europe, everywhere, in UK. Finally, I found a position to start my training in the Netherlands and could continue later in Brussels, in my own country, to become then a gynecologist in 1983. Meanwhile, I had followed public health, master's in public health and tropical medicine because I wanted to work globally. And my opportunity came, and I remained in academia because I wanted to work, academia, you can do research, you can teach, and you do a lot of service delivery, which is clinical work. So I was at Brussels University, and then the chance came in the 80s, mid-80s, because I had already visited University of Nairobi, where there was a small group doing research on gonorrhea, chlamydia, sexually transmitted diseases. And then the new virus came, HIV. So I was invited to move to Nairobi for 2 years to lead research with the question, can HIV have an impact on pregnancy outcome, on children? We didn't know anything about it. It was really the pioneers' work. And I joined a small group at University of Nairobi with Canadians. Later, University of Washington joined, and it was really great. I worked in maternity in slums in vulnerable groups in Nairobi, where we had 80 to 100 deliveries a day, every day.
Goodness, every day.
Every day. That was really the cradle of mankind. A lot of people came there. It was purely maternal and newborn health. Doing research, we set up the research site for HIV, of course, a gold mine for research. And in 87, 3% of the women were HIV positive. A few years later, 30. But besides doing research, we saw women dying of preventable causes. So many needs. So I started working as a clinician, raising funding, setting up, going to embassies, to UN agencies, to funders, to really invest in the maternity. I imported the first ultrasound machine in Kenya in 87. I was pregnant myself then, very motivated. But
Oh, wow. Yeah, you were
changed.
motivated.
Oh, yeah, absolutely. But it really changed the way of doing medicine. So I stayed finally 6 years together with my husband, my baby, my boy. Then after 6 years, we decided to go back to Belgium. But I was so grounded in Kenya. I started an NGO there, the International Center for Reproductive Health, to work with Kenya colleagues, with the communities, with the ministry, to improve women's health and rights. That NGO is still there. It's now it started in 94, then in Kenya in 2000, also in Mozambique. So we have a kind of a network of NGOs working on International Center Reproductive Health, Sexual and Reproductive Health and Rights. Meanwhile, I did my PhD on HIV and pregnancy. Of course, we did a lot of research on that topic, defended my PhD, and became later in Belgium the first professor gynecology in the Benelux, female, in my own university, where at that time they were happy to have a woman there because patients were asking for women gynecologists. And the whole staff was only men. Initially, the door was closed, but so many years later, I was welcomed and worked at the university in Ghent. And I asked my vice chancellor, can I start a center here for support and research capacity building globally? A multidisciplinary center, not only medics or nurses, but also social scientists, nurses, human rights, because it's a lot about women's rights that we are doing. So I initiated all this and came to Kenya very regularly. Then the next step in my career, I was asked to run, because at that time in Belgium, I was a kind of an influencer. I wrote books, published, of course, in the scientific literature, became a professor at the university, and was very often on radio, television about women's issues. I was invited to run for elections in 2000. Initially, I
In
said, no,
Belgium.
I don't, in Belgium. So
Yeah.
I said, no way, I'm too busy at clinics and I'm doing research and I'm leading these NGOs. But finally, I said yes. So I became an elected senator in my own country, working in my university, the parliament, which I don't regret because I learned a lot. When you are leaving your comfort zone and you do a lot of work for women's health and rights, you publish, you write books, and you assume that the world knows about it and that it will have impact. It has impact to a certain extent, but parliamentarians, they don't read the Lancet, and they shouldn't. We should do better to talk to the parliamentarians, to the parliaments, to the governments, to the communities, to the media. We should develop this working with constituencies and highlighting the points that are so important. For me, throughout my career, maternal mortality is one of the biggest inequities in the world. Why are women today still dying, giving life? So many here in Africa. In my country, it's never zero. But like in Belgium, we have like 5 to 6 women dying for every 100,000 deliveries. In Kenya, it's 350.
Mm.
So there are so many inequalities, and it's a very strong indicator of inequality. So we work around this, but also around adolescent health and rights, family planning, early marriage, the whole women's rights agenda. So I spent 2 terms in politics, and at the end of that second term, I was invited to join WHO, the World Health Organization, where I became the chair of the Department on Women, Reproductive Health and Research, Women's Health. And so I stayed in WHO, learned a lot again, because working with the UN, not only WHO, but also UNICEF, UNFPA, you formed UN Women, really a global community where we could move these agendas on women's health and women's rights. So then, meanwhile, all the time I went back and forth to Kenya, to the NGO, the university, but also to my Pumani maternity, where I lost my heart so many years ago, to try to upgrade the services. So then, now 10 years ago, when I retired from, of course, my husband, myself, our second home, and now even our first home is Kenya. So I relocated to Kenya again in 2015, where I joined the Aga Khan University, where I'm still working, doing the same action. What is that? Working in the university, but also in the communities, in the vulnerable, poor communities in the country, to try to improve the health systems, not only at the university, but working with the Ministry of Health. For example, I have been appointed now by the governor here in Mombasa, a big county, as the chair of the board of the largest hospital here in Mombasa. It's a 730 bed hospital where we are trying now to invest in improving maternal health, reducing mothers' death, children's, but also going into the non-communicable diseases. There are a lot of women here who are dying of treatable diseases, cervical cancer, breast cancer. Breast cancer is a big issue. So together with WHO, with partners, with countries in the neighborhood, we try to get really this work up and going. And I must say, we have also, like many of us, actually really been impacted by the US government policies reducing US aid. Many of our projects were funded by US aid, so we had to lay off some of our staff, we had to close some of our programs. And we see the impact on maternal health. We see again, Kenya had done very well in controlling HIV/AIDS. So we had a very low rate of babies born, neonatal HIV infection. Now it's going up again because the funding has gone down. The government is trying very hard, but without, thing is that these programs have been stopped abruptly. And we see the impact really in the field, in young girls. The most vulnerable in society are the young girls. They have more new cases of HIV. They get pregnant. They don't have, the power to decide very often on their own lives. A lot has changed, I must say, because since many years now, all boys and girls have to go to school. The girls who go to school, they do better very often than the boys. But it's still a big, so many more girls here in Kenya and young women, they are strong, the Gen Z is very vocal. They are intelligent, they are trained, they are taking leadership positions, but there is a big, big gap with the poverty that we see up country. And we are trying with our communities, the NGOs, the ministries, we are really trying to make a difference, but it is a big, big problem. And it's not only the funding from US, also from European countries. There is really a pushback, which we truly regret. Yeah.
Well, it's interesting to hear this incredible story you've told. Most physicians, look at this and say, well, I want to become a good clinician, or I think it would be fun to be involved in international work, or occasionally people get involved in politics, much less the World Health Organization. You've had a chance to kind of dip your toes into every one of those things and be heavily involved. And even at this stage of your career, you're still very involved in what's happening in Kenya. And like you say, the loss of funding is abruptly has a huge impact, no matter where the payer source. I've been privileged to go to Africa on a number of occasions to do medical service work, and you can see a relatively small amount of money can go a very long way toward prevention programs and education and empowering people to solve their own problems. What have you noticed between when you first started this work in the 1980s until now? What have you noticed about the people in Kenya? What have you noticed about the attitudes and the understanding and the education regarding preventable disease?
Kenya is a great country. I love Kenyan people, of course, otherwise I wouldn't be here. When I came here in 85 till now, population has more than doubled. There were like
Mm,
22 Kenyans then. Now they're close to 60. Family planning and population growth is still, but we have seen major impact, surely in urban settings where we have more educated families. They prefer to have children, 2 to 3, to give them a better education than the traditional large families up country, which is still a gap. Kenya has evolved a lot, as I said earlier. Education, boys and girls have to go to school. Education is for me, the number one change a country. Kenya is seeing changes, absolutely. More education, more innovation, technology. Some of them in Kenya are number one. We, all Kenyans, transfer money everywhere. The coverage of a phone, a smartphone, is very high. Other opportunities. We do everything on our smartphones, sending
yeah.
money, paying. There are technologies and many more in Kenya, a lot of innovation technology. The health sector has also evolved a lot. But still, we are struggling with the difference between private sector and the public sector. Public sector is struggling. The government is trying to have a kind of social health authority that every Kenyan should be covered, but the vulnerable populations, many of them, they don't have IDs. So there is a big, big gap. The good thing is, again, back to education. Here in Mombasa, for example, in the coast in Mombasa, there was no university till about, 14 years ago. Then the Polytechnic changed into a university. And with a small group of people, we were so excited that we came to the brand new university. We asked them, do you have a medical school? No. Do you want a medical school? Yes, of course. So I then contacted my vice chancellor at Ghent University, the dean. We brought these communities together. Then the government built a building on campus. We got a little bit of funding here and there. And now next week, 4th of September, we open the first medical school here in the county. So this is a huge opportunity for the coast. Coast has always been a bit neglected to also have their medical school. We have now only 40 positions. The governor himself, he is also sponsoring a few more. So we will start with like maybe 50 students. We had 450 applications. So we built this curriculum, but we still need, and I'm doing fundraising all the time, we would really want, in my university in Ghent, we have a fund that is called Fund Marleen Temmerman, where Belgian people, they provide some money that we are using for Kenyans and Mozambicans and others to go for higher education. Now I have maybe I've finalized 60 PhD students, most of them from here, who were given the opportunity to do research, but now they are clinicians, people from the ministry, research. We have a community that helps them to publish, to raise funding, to raise grants, and then to invest in their own career. I see my old students now, years ago, they are now vice chancellor of university, they are in the ministry, they are in Swahili we call them the mama kubwa, the big mamas, the big leaders. And that's really what makes me very happy, contributing to development and to make sure that the Kenyans, they have so much potential. They are the leaders of the future. It's not me who has to talk about problems of female genital mutilation in the country. Of course, I can talk about it. We do research, we know the problems, but it will only change with the young Kenyan women and men who come forward and who really want to stop this harmful practice. With child marriage, teenage pregnancy, so many problems. But now with all these young people that we didn't have 40 years ago, there were hardly female students at the university, and they hardly could speak to a professor. Now they are the ones coming in the streets. They have a vision, a mission. So a lot has changed, and that's why I believe in this country and the countries around, because with education you can develop your middle class. There will always be a difference between the poor and the rich and so on, but important is that you give education, job opportunities, and that the middle class can develop themselves, can become the future leaders. So for me, it's very important. And everyone who wants to help there, you are very welcome.
Well, like you said, education is the key, because I think you made a good point. If you show up as a person from another country and tell them all their problems and tell them what to do, very few people will actually change. But if you educate people and help people to become empowered so they understand it themselves, then you're now seeing the fruits of your labors. Decades later, you see all these intelligent people who have been educated. They understand the problem from all sides, both culturally and scientifically. And then they go back to their communities and say, okay, let's make change from within. And boy, that'll leave a multi-generational impact, and it'll let people pull themselves out of that poverty cycle. And I like your comments about developing a middle class. We've noticed when my group's gone to Uganda and Kenya before, that there's just not much of a middle class, at least out in the rural areas. And so you get a group of people that's educated. They have the same goals as everybody. They want a peaceful life with low disease and the ability to take care of their families. And that's wonderful. It's really pretty neat that not only do you have these wonderful ideas, but you've been able to actually do it. And now you're living in Kenya, seeing the fruits of your labor, and you're starting a medical school. Pretty cool.
Next week, we are so excited. Yeah, absolutely. Because that will make a big difference. The hospital where I'm working now here in Mombasa, the Coast General Teaching and Referral Hospital, it's a government hospital with a lot of problems, but also a lot of steps. You know, we have developed a beautiful cath lab, a new ICU, a pediatric accident and emergency. We are now raising funding locally and internationally too, really become not only for Mombasa, but for the whole coastal area, which is about 5 to 6 million people, to have cancer detection, screening, treatment. Because like the women who are coming here with breast cancer, very often they are, too late. Cervix cancer, we have in Kenya every year about 6,000 women die of cervix cancer. Another 6 to 7,000 of breast cancer. So many, the same numbers of birth giving life. So with better systems and technology, we are also in the university, of course, participating in new technologies, looking at AI, artificial intelligence in medical diagnostics. But, it's good to develop that, but it can only have an impact when you can really use it in the population, not only for the upper class, the very few who have the money. So that's what we are trying to work towards. And I'm sure that we can make a difference even in this coastal area. But we need really, and there are Kenyan philanthropies. There are rich people, of course, in Kenya. And some of them, they really also invest in their community. They pay back to their community. I've recently met a group of people because all these years that we worked in this maternity, Pumani Maternity Hospital, calculate if you have now it's a bit less, it's 50 deliveries a day, but still a lot. The millions of Kenyans who are born in that facility, many of them are now big leaders, businessmen making a lot of money, politicians, rich people. So we are setting up a kind of a fund, say in a group, we call them the children of Pumani, and calling up on it, you have to pay back to the place where you have seen the light, right? Where you are born and you are a healthy baby grown up. So, that motivates people to invest in this facility. So that's the kind of work we are doing. Advocacy, but also working with NGOs, with the communities, because it's the communities, not me. I'm still, I'm Kenyan since so many years. I feel like a Kenyan citizen, but
Yeah.
I'm not a Kenyan. I'm still an outsider, a Mzungu. Although my first book I wrote in my language is called Mama Daktari, and that's also my Twitter name. Mama Daktari is Madam Doctor. But I think it's the Kenyans now who are taking over. We can only support. We can give them the opportunities to indeed take care of higher education, to do their PhDs, because our students from Belgium, they come here, the medical students from Ghent University, 30 years for their electives. That's fine. But there needs to be reciprocity. Kenyan students need to go to Belgium, maybe not to work in our maternity because they learn much more here, but to learn technology, to become maybe, in radiology and engineering. So that's what we are setting up, this reciprocity.
Another question on this is funding sources are hard. You mentioned the sudden cutting off of USAID, which is a big one. How do you see, outside of trying to get people in the country, especially those who have been successful in business or other things, how do you see fundraising going forward? Because it's a big deal. Most countries that are sub-Saharan Africa, the average income for people is very low. Sometimes it's $1 or $2 a day for a laborer. And so it's very low income. And at this point, Kenya and all of Africa really does depend on outside support and money for a lot of the development of these programs. So how can people get involved? How would you see funding going forward for some of these programs?
Yeah, so as I said, we suffered from the USAID stop. Also, NIH, we had a number of NIH programs in the universities that are coming to an end. So we have, of course, we work with other European programs. Horizon is a good funding agency, but cannot really fill the gaps. I'm not talking about research. So there are, of course, also the European partners, but also there from government support, it's going down for many countries. We are happy that there are big foundations. So we live, part of us, surviving our programs with the Bill and Melinda Gates Foundation. The Gates
Hmm.
Foundation is supporting our community programs, but also a lot of innovation and technology and trying to, they really have a huge impact here in Africa. So we are
Hmm.
very grateful for that, and we are working. They have many programs, but the ones that I know is the Women Health Program, where they work in maternal health, child health, immunization, family planning. Now also more and more into sort of maternal health, but also in other health problems. Cervical cancer is one of them. So we get a lot of support from them, which is good. There are a few other foundations. We are really reaching out and trying, but like for most of my work in academia is supported by grants. Grant writing is really major undertaking. If you write 5 grants with your team, or 10, and you have 2 that are awarded, you can be happy. And so we have to train the people in writing grants, publishing. So it's a continuous challenge. Like this year, by the end of next year, my team at the Aga Khan University, my research team, it's called the Center of Excellence for Women and Child Health here in Nairobi at the Aga Khan University. We were like 80 people, all of them making all of us from the highest to the lowest, based, paid by grants. So with all the global reduction and support, we are now 45. So we had to lay off quite a number of people. The NGO, the International Center Reproductive Health, the same. So it's really, we try to, and then we say, well, we have to not to depend too much on donor funding, maybe which is true. But the fact that it happened so suddenly, I could accept that the donor, like US, is saying, look, guys, you are now evolving and you have to take gradually more and more of your own business. We reduce maybe international collaboration or funding with like 10% per year
Right. It's
for
hard to
10
go from
years.
100 to 0 all at once. Very hard.
It's impossible. And then you
Yeah.
lose all these people who have been trained, the capacity. In the hospital, we had a very good comprehensive care clinic for HIV patients. But we have to lay off these people. And there is less women who are coming now for the PMTCT as prevention of maternal transmission of HIV. That is going down again because the money is not there anymore, only a bit to test the moms, to provide them with antiretroviral medication. So it has an enormous impact. Yeah.
Well, and HIV specifically is a disease that it's a worldwide disease. So what happens in Kenya or any country, if you have a large disease burden go up, that does tend to impact people worldwide. So I think it's money well spent when all countries look toward prevention programs that help people to not have that. And so that is
Sure.
a big problem. Another question for you is, so a lot of people listening to this podcast, most people listening to this are physicians. And there's somebody out there listening saying, boy, Dr. Temmerman has had this amazing career. How do I get involved in something like that? What would you tell of an aspiring young physician or someone who's been in practice for a while and says, hey, I want to give back to the world community and I want to be involved? How would you tell them to begin the process of trying to become involved?
There are so many opportunities, I think, wherever you are in the world, whatever you do. Let's say now, young physicians, what can you do? You become a physician. The first thing is that it's important that you deliver good medical care, whatever specialty or GP
That's
or
right.
wherever you are. You treat your patients with high quality. You follow the guidelines. You make sure that you have a good respect for the patients you are dealing with. So that is kind of the basic. But how can you be involved in every community? There are opportunities to get engaged in community health centers, to do some work for free, voluntary work here and there. If you are at a university, you can be involved in research, in global research. We have a number of US partners, like we work with university, we work with Johns Hopkins University, we work with University of Washington, Seattle, we work with Michigan University, just to name a few. So with these universities, we have exchange programs. We have young doctors, US doctors, who work with that. We team them up with kind of doctors or health workers from this part of the world. There are a lot of opportunities for scholarships and to get engaged. Like the best projects are the ones where you have a sandwich program with a US person, with somebody from here, and you grow together, you develop these capacities together. But even if you are not in universities and wherever you are in the world, you can always look for if there is an opportunity. And if you are fully busy with your own business, you don't have time to engage, maybe you can share some of your wealth, like the foundations are doing. We mentioned the Gates Foundation, but there are others as well, of course, who can share part of their fortune and then maybe invest in this kind of global health or global society programs. There are many.
Well, and I think everybody hopes for a coming day like what you envisioned, when you started out, is some of these inequalities, some of the things where a nice person is born in Europe and a nice person is born in sub-Saharan Africa, and yet the opportunities for health and education and things are just so vastly different. And so when I think we hope for a day when those equalities are improved, and a lot of people have different outcomes, but if we can provide some more parity in the opportunities people have. And I think I heard a comment once about some of the artificial intelligence technologies may be really beneficial in some of these lower resource locations, because if, I know just at home when you have an EKG or a radiology read, sometimes there's automatically a preliminary interpretation that comes out on some of that stuff. That could be a big benefit if you say, well, we have an ultrasound or we have a X-ray and we don't have a radiologist look at it yet, but we have a really clear idea of what this is and some of the ability to share screens across continents to say, I need
Sure.
someone to look at this. I think that provides a lot of awareness, and from a medical standpoint, that helps. And so there's ways for people to get involved, whether through a local foundation or a university, or send your dollars to
Now,
work in places like where Dr. Temmerman works.
and yeah, we have like telemedicine is already starting to grow here. That people don't have to come, but you can do with telemedicine, you can do a lot. If I may, just one advice to the young people maybe who are listening, I think in my career, I come from a very humble family where girls usually don't go to university. My three brothers was no problem, but I had really to convince my daddy, who was saying, but why don't you become a teacher or a nurse? Why do you want to go to universities? That is not for our kind of people. But they allowed me, and I would say, if you have a chance, take it. Number one. My mother always said, if you want to reach for the moon, maybe you grab a star. It's of course the opposite, but I mean,
Right.
so grab the opportunities. Then the other thing I would say, don't take no for an answer. I've been told so many times in my life, this is not possible, this is not for you, this is not for us, this is not possible. You can't become a gynecologist, you can't become a medical doctor. Just saying no makes me even more convinced I will do it. So don't take no for an answer. And then another one is also maybe don't be afraid to leave your comfort zone. Because if you go somewhere else and you talk to other people, it felt like a bit, oh my God, what is this? I don't understand what I'm doing here. The right person to say something. Me in parliament, oh my God, no. So you always think, why can I not do the same as somebody else or even better? Surely for girls, it's really a step, an extra. They have to make it, to prove that they can do those things. So to the girls who are listening, to the young women, be sure that you can do as well as your boys, colleagues, the men, even better sometimes because you have to fight even harder.
No, wonderful advice. I appreciate it. How can people follow your work? I was introduced to you by one of our previous guests, Megan Missinelli. She had an episode that came out on the podcast on May 23rd. If you want to listen to Megan's wonderful podcast, but she was just fascinated by Dr. Temmerman's work, and I appreciate her introduction. How can other people follow your work? What's the best way for them to observe, to see all the things that you're involved in?
So my LinkedIn account, just my name and you find LinkedIn. We have websites from the International Center Reproductive Health. Aga Khan University, I must say they need to be a bit updated, but LinkedIn is probably the best. I still have Mama Daktari is my Twitter account, but I don't do much anymore. I think that's the most important.
Okay.
You can always write me an email, of course. You can share my email address.
Okay. Yeah. If you don't mind, I'll share your email in the show notes because, again, what you're doing is very important. You've already observed that it's leaving a major lasting impact that will persist for decades and decades and hopefully generations. And I think that those little seeds that you've planted in the 1980s are still bearing fruit, and the seeds you're planting in 2025 will bear even more fruit in the future. And so we're preaching this to the next Dr. Marleen Temmerman. There's more people out there who want to be involved in this type of work. And I appreciate you taking the time to share your story. I find it inspirational, and I think it's amazing what you're doing, what you have done, and what you're still doing. So thank you for what you're doing.
Thank you, Peter, for inviting me. I really appreciate it. Thank you.
Thanks for tuning into the Doctors Making a Difference podcast. And thank you for what you do to help your patients and your community. Your work truly helps so many people. We produce this content to help you have the tools you need to stay in medicine and to highlight the amazing work being done by physicians around the world. Please note that while I am a physician, and many of the guests on this program are also physicians or other professionals, the discussions on this podcast do not represent my employer or any professional organizations to which I belong. This podcast is for your information and entertainment only, and should not be taken as professional advice. You should seek appropriate professional advice pertaining to your own situation. Please check out more of our content on our website, doctorsmakingadifference.com. Also, please follow, like, or subscribe on your podcast player or YouTube channel, and give us a 5-star rating. It really helps to spread the message. Finally, if you'd like to be a guest on the podcast, or if you'd like to nominate someone else to be a guest, please visit the website or email admin@doctorsmakingadifference.com. See you next time.